Hello, my name's Kim Wilcoxon. I'm a partner in the Employee Benefits and Executive Compensation Practice Group of Thompson Hine Cincinnati office, and I'd like to welcome you to today's webinar. I'm pleased to be joined today by my colleague, Mark Kroboth, an Employee Benefits and Executive Compensation Associate from our Cleveland office. During today's webinar, Mark and I will walk through a few issues that employers should consider when addressing the end of the emergencies. Specifically, we plan to review the COVID-related emergencies that impact employer-provided group health plans, identify plan changes that may have been made in response to legislation or guidance, and confirm the extent to which the end of the emergencies will impact those plan changes, discuss the outbreak period deadline extensions, and provide examples of how the end of the emergencies will impact deadlines, and address the extent to which plan amendments and communications must or should be provided. So during today's presentation, feel free to use the question box in the control panel at the upper right-hand corner of your screen. We'll answer questions at the end of the webinar as time permits. And to proactively address a question we get a lot, we will be providing a copy of the slides and a copy of the recording to all registrants after the webinar. Now, I'll turn it over to Mark to start today's program. Mark?
Thanks, Kim. So most of what we will be discussing today obviously stems from the COVID-19 pandemic, but more specifically, it stems from two emergencies that were declared. So the first emergency is the public health emergency, or the PHE, and that is declared by the Department of Health and Human Services. And this emergency was, dates back to, almost the beginning of 2020, and it renews on or terminates after 90 days unless it's renewed. So obviously it has been renewed many times at this point, and it was most recently renewed on February 11th, 2023. But this renewal was a little bit different than the ones that came before it, in that the Secretary of the Department of Health and Human Services wrote a letter to state governors letting them know that this is going to be the last time they're going to extend the public health emergency. And so the second emergency that sort of drives these changes is the national emergency. And the national emergency is declared by the president, and it terminates after 1 year if not renewed. And so obviously that has also been renewed multiple times. Back on January 30th, 2023, there were some bills that Congress was considering that would have terminated the national emergency immediately, and President Biden announced to Congress that he intends on terminating the national emergency on May 11th, 2023, and urged them to not terminate it before then, because there are things that need to happen. There's a winding up that needs to occur. There's notices to impacted individuals that they want to occur before that, the rug is sort of pulled out from under everyone. So then on February 10th, the president announced that he will be renewing the national emergency once again. However, he intends on proceeding as if May 11th is going to be, the date that he's going to terminate that. So since these national emergencies were driving plan changes, I'm going to walk through some of these changes. On these next few slides, you're going to see changes that were required and some that were optional. On this first slide, I'm going to talk about the changes that were required to be made during the pandemic, or the public health emergency, and that may be retained following the end of the public health emergency. So the first thing is that plans, it was a requirement to cover COVID-19 diagnostic testing and the related visit at 100%. And then later there was a requirement to also cover over-the-counter tests at 100%. After the end of the public health emergency, plans may impose cost sharing or not cover these diagnostic tests or related visits. Similarly, plans may stop coverage for over-the-counter tests, or choose to apply cost sharing restrictions on these items. One thing that you normally wouldn't think of in relation to these extensions is mental health parity. And the mental health parity rules there's a rule in mental health parity that says if you have a numerical limitation, also known as a quantitative limitation, then you cannot unfairly or apply more of those numerical limitations to mental health or substance use provisions in your plan than you would for medical surgical. So if you're applying cost sharing to medical or applying cost sharing to substance abuse or mental health disorders, and you're not applying enough of those restrictions to medical surgical, then you may run afoul of these mental health parity rules. And that could be a result if you decide to continue to cover these tests and visits and over-the-counter tests at 100% following the end of the public health emergency. And some of you may know that mental health parity has sort of been an enforcement priority for the Department of Labor over the past year or two. So the second thing is during the public health emergency, there was a required payment amount set for COVID-19 diagnostic tests. So for plans with a network, inside the network, plans were negotiating with the provider and paying the full negotiated rate. However, if for out-of-network providers, it was a little more difficult. There was a law that said if there's no agreement in place, then the plan has to pay the provider's publicized cash price for the test. And after the end of the public health emergency, the plan will be able to determine what is reasonable, and they'll be able to make that payment to those providers. So for in-network providers, there's going to be a negotiated rate, so it's not too much that's going to change. But for out-of-network providers, plans will not be required to pay that posted cash price for the test. And then the third change that was required was that there was a requirement to cover COVID vaccines at 100%, both in-network or out-of-network. After the public health emergency, the out-of-network will not be required to be covered at 100%. And for in-network providers, plans that are subject to the Affordable Care Act rules on preventive services, which is likely most of the people listening to this call, they will be required to continue to provide that 100% in-network as a preventive service under the Affordable Care Act, as long as those COVID-19 vaccines remain on that preventive services list. So the second slide shows changes that were optional during the pandemic, or I guess just a single change that was optional during the pandemic and may continue to apply pending further guidance. So stepping back before getting into the requirement, we should remember that plans that are high deductible health plans are not permitted to cover items and services other than preventive care at 100% before the deductible has been satisfied. If those items and services are covered before the deductible has been satisfied, it will impact an individual's ability to contribute to a health savings account. But however, during the pandemic, plans were permitted to provide first dollar coverage for COVID-19 testing and treatment that was provided under an individual who was in a high deductible health plan. Following the end of the pandemic, plans may continue to provide first dollar coverage for testing and treatment for COVID-19. However, there's a catch here, and unlike the guidance that I talked about on the last slide, which sort of terminated consistent with the end of the public health emergency, this guidance or this related change was until future guidance. You could continue to provide this first dollar coverage. So until we have further guidance that says you're no longer going to be able to provide this coverage, you should be able to rely that you can. And I will say though that there's one more thing to keep in mind. You're going to also want to keep in mind the mental health parity rules and the quantitative treatment limitations related to this first dollar coverage under COVID-19 testing as well. So the next slide is changes that may apply during the pandemic that you're not going to be permitted to continue afterwards. So the first one is that plan may provide COVID-19 diagnostic testing under an EAP without losing its accepted benefit status. And so generally speaking, an EAP cannot provide significant benefits in the nature of medical care, and if it does, it will be a group health plan. So a lot of EAPs are structured to be exempt from the group health plan requirements, because if you're a group health plan, you bring in lots of compliance obligations, the ACA market reform provisions, which are pretty strict, and they're it's a lot more than just the accepted benefit EAP requirements. So this guidance allowed an employer to provide diagnostic testing without losing that accepted benefit status. And when the emergency comes to a close, plans that would want to continue this would need to determine whether or not this providing of diagnostic testing is in excess of what you could provide under an accepted benefit EAP. And I will say that what constitutes significant benefits in the nature of medical care is not always entirely clear, and there really is no bright line standard. So there's going to be some judgment and some risk here, but if employers who adopted this relief don't want to expose themselves to that risk, then they would want to change their EAP to no longer provide these services. So the second one is that you may offer a telehealth only plan to employees who are not eligible for the company's medical plan. So maybe you have a 30-hour per week requirement for individuals to be eligible under your medical plan. So you decide during the public health emergency that you want to assist your employees who are not eligible. Maybe you have a large class of employees who's working under 30 hours per week. Maybe they work 15, 20 hours per week. Similar to the EAP issue just discussed, if you provide this telehealth only plan, you may be providing benefits that are significant benefits in the nature of medical care. So if you continue these types of programs after this relief, you're going to probably run afoul of the ACA market reform rules. So, one other thing to note is that this relief is based on the plan year, and so you can have a plan that, as long as you don't have a plan that begins on or after the end of the public health emergency, you'll be protected under this rule. So let's say you have a calendar year plan, you're going to be able to continue to provide those telehealth only services until December 31st, 2023. And the last box is, I don't know how much more of a practical application it has at this point, but essentially if you allege that you cannot meet your deadline for providing participant notices or responding to document requests, there will be no action taken against the plan, assuming the fiduciary acted in good faith and furnished the notice as soon as administratively practicable. So at the beginning of the pandemic, as we were sort of filling out a lot of work from home and could people even get mail? There was some impediments to providing notices, and if somebody made a document request, it might not be as easy to get them that document request. But now, as things have moved along, and this is the life we live in now, this pandemic age, we've been able to figure out how to meet those deadlines. So it's not likely that this would have much of a practical application, but to the extent that it still would, and that you could make a good faith argument that, due to the public health emergency, you either couldn't, meet a distribution deadline to provide a notice or provide a document request, that guidance is no longer applicable beginning 60 days after the announced end of the national emergency. So this slide shows a few more changes that were optional, but can continue following the end of the pandemic. So the first one is employers could provide COVID-19 vaccines under an EAP without losing accepted benefit status. And so the guidance that we have does not limit this provision to the public health emergency, meaning that we believe it's going to go on beyond the end of the public health emergency. And if you think about it, this is sort of similar to maybe a flu vaccine. Employers will often provide flu vaccines under their EAP so that individuals who maybe haven't elected the medical coverage or are under, another employer's plan medical coverage can get their flu vaccine, as long as certain provisions are met that are sort of outside the scope of this presentation. But it would be similar to that, as long as it's, structured within those rules that, a COVID-19 vaccine would remain eligible to be covered under an EAP. So the second change was, it occurred during the national emergency, but it wasn't really impacted specifically by the national emergency or the public health emergency. So this change allowed over-the-counter drugs, menstrual care products, and COVID-19 PPE and in-home COVID diagnostic testing to be reimbursed from a healthcare FSA. So, like I said, this change is this ongoing. So, employers who opted to implement this change will, likely, since they opted to implement it, will likely want it to continue after the pandemic is over. And they are obviously within their right to do that. If they don't want to, they could also amend their plans to get rid of that relief. And then the last thing is that plans may provide first dollar coverage for telehealth services under a high deductible health plan. So even though, telehealth services might not be preventive care, and absent any relief, you normally would not be able to provide non-preventive services under a high deductible health plan before the deductible has been satisfied. With this relief, you were eligible to do that and allow any individuals to continue to provide or contribute to a health savings account. So this relief was extended for plan years beginning on or after December 31st, 2022 and before January 1st, 2025. Therefore, this is going to continue obviously beyond the end of the national emergency and the public health emergency. Whether or not it will continue beyond January 1st, 2025 remains to be seen. I think there's a chance that, legislation could be enacted that would either make this permanent or push that sunset date, down the line. So one other thing to add here is that you may have heard that this relief sort of stopped and started, and they were thinking about terminating it, and it never really was terminated in full. However, the waiver for 2022 dealt with calendar months, whereas the relief for 2023 dealt with the plan year that starts beginning on or after January 1st, 2023. So if you have a non-calendar year plan year, there could be a gap in this relief. So think of a June 1st plan year. So if you have a June 1st, the plan year that begins June 1st, 2022, obviously you're going to have relief before that from April to December because there was calendar month relief. And then the relief for 2023 begins on the first day of the plan year that begins on or after January 1st, 2023. So from January 1st, 2023 to, your plan year begins on June 1st, this relief did not apply. So, but let's say, for example, that, you accidentally are still paying for these telehealth services without cost sharing for folks who are in a high deductible health plan. How does this impact their HSA eligibility for 2023? There's actually a rule that says if you are in a high deductible health plan and you can contribute to an HSA if you are eligible on December 1st of that year, and you would be eligible to contribute the full amount for that year, as long as you remain eligible to contribute to that HSA for the full next calendar year. So, normally if you are, at the beginning of this year in January, you were paying for these telehealth services that are not preventive services before the deductible has been met. For some, but not all employees, it may not impact their ability to contribute to an HSA. And these rules are pretty tricky. So due to the complexity, it may be worth checking with an advisor if you have a unique situation such as these and you want to know how to proceed. So now I'm going to pass it back to Kim, who's going to provide a summary of the deadline extensions that were required during the pandemic and the winding down of those extensions.
Thanks, Mark. Back in 2020, we received some guidance from the tri-agencies to tell us that the outbreak period must be disregarded when determining deadlines for certain events. And that would be HIPAA special enrollment deadline, a deadline for making a COBRA election, the deadline for making a COBRA payment, the deadline for a COBRA qualified beneficiary to provide notice of a qualifying event or a disability, deadline for filing a claim, deadline for requesting an appeal, deadline for requesting an external review, and deadline for perfecting an external review request. So you can see here, if you'll go back, Mark, I'm going to spend a minute talking about this slide. The deadline extensions impacted medical plans, but they also impacted group health plans for purposes of the COBRA deadlines, and they impacted all ERISA plans when we look at the deadlines for filing a claim or requesting an appeal. So the outbreak period deadline extensions, are not limited to group health plans like we're talking about on the webinar today, but will actually impact even retirement plans as well. Next slide. The guidance that we got originally, as I mentioned, said that we needed to disregard the outbreak period when applying these deadline extensions. The outbreak period is the period that begins March 1 of 2020 and ends 60 days after the announced end of the national emergency. And I think when this guidance was issued, we didn't have a good sense as to how long this outbreak period was going to last. Once we got to about a year, the agencies came out with some additional guidance and said, oh, gee, we don't actually have authority to require you to disregard more than a year. So you need to disregard the outbreak period, but not more than a year when applying these deadlines. And that sort of difference is going to become important as we look at the end of the outbreak period. So I want to go through a couple of examples of deadline extensions and how they would be impacted by the outbreak period and the end of the outbreak period. The first one being HIPAA special enrollment. So under HIPAA special enrollment, without this deadline extension relief, plans are required to permit a period of at least 30 days following a special enrollment event, or 60 days for a Medicare CHIP event, to enroll in the plan. Now, coverage, the actual coverage, has to be retroactive back to the date of the birth, adoption, or placement for adoption if a HIPAA special enrollment request is made. But all other HIPAA special enrollment requests, the coverage can be prospective. It's up to the plan to decide whether that coverage is going to be retroactive to the date of the event or prospective. And employers may have done different things pre-COVID. They may have made a change during the outbreak period to address this potential of a whole year of retroactive coverage. So let's go through an example and we'll sort this out a little bit. So let's assume that our national emergency is going to end May 11th. 60 days after May 11th would bring us to July 10th. So we're going to assume that the outbreak period ends July 10th. We know that the outbreak period, but no more than a year, must be disregarded in determining the deadline for enrolling through HIPAA special enrollment. So let's look at example one. Let's say Joe was married on February 14th of 2022. Absent COVID, the deadline to add coverage for his new spouse would normally be March 16th of 2022. That plan provided a 30-day enrollment window. The period of February 14th, 2022 through July 10th, 2023 generally is disregarded. That's the outbreak period. But because that period exceeds a year, we only have to disregard the year. So only the period of February 14th, 2022 through February 13th of 2023 is disregarded, which means, and I like to think of this as like stopping the clock, right? So the 30-day deadline for enrolling the spouse doesn't actually start. That clock doesn't start until February 14th of 2023. So then it's going to end 30 days later, March 16th of 2023, and that's when Joe must elect coverage. Now, under the terms of the plan, that coverage might be prospective beginning April 1 of 2023, or it might be retroactive all the way back to February 14th of 2022. If the coverage is retroactive all the way back to February 14th of 2022, that employer might want to think about, okay, well, if he actually does enroll his spouse and has all that retroactive coverage, how are we going to deal with the retroactive premiums? Is that something where we're going to make sure that Joe has to pay all the premiums right away in order to get that coverage? Would we offer a payment plan? Right? So these types of questions may have been a reason why an employer, once this outbreak period deadline extension was issued, said, oh, I think we're going to change our plan. Even though it's normally retroactive, our coverage is going to be retroactive to the date of the event. We want to avoid this potential of a whole year of retroactive coverage and a whole year of retroactive premiums. So we're going to make HIPAA special enrollment effective prospectively to the extent we can. An employer who was in that situation, as we approach the end of the emergency, might think about going back to pre-COVID terms and allowing everything to be retroactive back to the date of the event, or might consider sort of the split approach of some HIPAA special enrollment events being prospective and some being effective retroactively. It is a decision for the plan to make. You can do either one. It's something you probably want to work out with your administrator. So that was an example of, we had an event and that's not impacted by the end of the outbreak period. Now what happens if the end of the outbreak period occurs before the end of our 1-year extension? So let's say Jen has a baby on November 15th, 2022. Deadline to enroll the child in coverage, absent COVID, would be 30 days later or December 15th of 2022. We know that the outbreak period, so the period from December 15th of 2022 through July 10th of 2023 is disregarded. Now that period is less than a year, and that's fine. We're still going to start our deadline clock on July 11th of 2023, even though we haven't had the full year. And this may be where people get a little confused. There may have been, communications about deadlines being extended for a year, or people may have gotten used to extensions of a year. Well, it's not going to be a full year for events that occurred within a year of the end of the outbreak period. So we start that 30-day clock on July 11th, and Jen must elect coverage for her child by August 9th of 2023. And that coverage, because it's a birth, does have to be retroactively effective to November 15th of 2022, and that employer is going to have to figure out how to deal with the retroactive premium. Because it's a birth, we don't have the choice to make the coverage effective prospectively. Next, I'll go through some examples on COBRA elections and payments. So absent COVID, COBRA elections generally must be made no later than 60 days after the election notice is provided. But we know that election deadlines are extended as a result of the outbreak period. COBRA payments generally must be made on the first day of the coverage period. So if I'm paying for June coverage, June 1 is my due date for making the payment. But the payment's not late if it's made within a 30-day grace period. So if I make my payment by June 30th, then I still get my June coverage. Now, the exception to that rule, absent COVID, is that the first payment, after the person makes the COBRA election, they generally have 45 days after the date of the election to make that first payment. And that first payment must include payment for any coverage periods that have already occurred. But payment deadlines are also extended as a result of the outbreak period. So a question came up as a result of this. If we know that the deadline for making a COBRA election can be extended for up to a year, and the deadline for making a COBRA payment can be extended up to a year, can we take a year to make our COBRA election and then another year to make our COBRA payment, meaning that the first payment wouldn't actually be due for almost more than 2 years after the date the COBRA notice was provided? And the agencies told us, no, we're going to run those election and payment extensions concurrently. And we'll see an example of that in here in just a minute. But first, let's take a look at an election period example. So let's again assume that the national emergency ends May 11th and the outbreak period ends July 10th. The outbreak period, but no more than a year, must be disregarded in determining a COBRA election deadline. So let's do example number 1. Let's say Amy's 60-day COBRA election period begins February 20th, 2022. Absent COVID, her election deadline would normally be April 20th of 2022. That's 60 days later. The period of February 20th through July 10th generally has to be disregarded, but that's more than a year. So we're only going to disregard that year of February 20th through February 19th. We start our deadline clock on February 20th, and that should bring us to a COBRA election deadline of April 20th, 2023. Now let's look through an example where the outbreak period ends before the year's extension is over. So let's say Amy's 60-day COBRA election period began February 20th, 2023. Her election deadline, absent COVID, would be April 20th of 2023. We know that the period of February 20th, 2023 through July 10th of 2023 is disregarded. It's less than a year. That's okay. We start our clock on July 11th. So Amy's COBRA election deadline is going to be September 8th, which is 60 days after the end of the outbreak period. Now let's layer onto that the initial payment deadline. So we're going to use that same example. Amy lost coverage February 1, 2022, received a COBRA notice on February 19th, 2022. Amy's 60-day election period normally would begin February 20th of 2022. Her deadline normally would fall on April 20th, 2022, but we're going to extend her deadline to April 20th of 2023, as we just went through in the last slide. If Amy elects COBRA on or before April 20th of 2022, that's her generally applicable 60-day election period. Her initial payment will be due 1 year and 45 days after the date she makes her COBRA election. So we're applying that outbreak period deadline extension only to the election deadline because she didn't take advantage of the extension for the, for the payment deadline because she didn't take advantage of the extension for the election deadline. So if she elects COBRA on April 20th of 2022, her initial payment would be due 1 year and 45 days after the date of the election, June 4th of 2023. But let's say she, let's say she elects COBRA after April 20th of 2022, so after her normal 60-day election period. Her initial COBRA payment then is going to be due 1 year and 105 days after the date the COBRA notice was provided. So what the agencies are doing here is they're giving us 1 year plus 60 days to elect plus 45 days to pay. So 60 plus 45 gives us 105. We don't get 1 year and 60 days plus 1 year and 45 days. We get 1 year plus 60 plus 45. So if she's taking advantage of the deadline extension to elect COBRA, her initial payment is going to be 1 year and 145 days. That's June 4th of 2023. Just so happens to be the same deadline. Next slide. So let's assume, again, that the national emergency ends May 11th of 2023. The outbreak period ends July 10th, 2023. But we're going to do an example here where the outbreak period ends less than a year after the deadline. So again, we have our 60-day COBRA election period beginning February 20th of 2023. Normally, we would give Amy till April 20th of 2023. That's 60 days to make the election. We know that her election deadline is going to be extended to September 8th. We're going to start that deadline clock on July 11th. That's going to end 60 days later on September 8th. So let's say Amy elects COBRA on or before the end of the outbreak period. If she does that, then her initial payment date, right, is going to be 45 days, disregarding the outbreak period. So her election happens before the end of the outbreak period. We start her payment clock on the first day after the outbreak period. So we have 45 days after July 10th, which takes us to August 24th. If she makes her initial payment on August 24th, that payment generally is going to have to include premiums for the periods of February 23 through July of 2023 if she wants to have COBRA coverage continue in force. And that's because that payment date needs to include any payments that would have already become due. Now, she doesn't have to make all those payments. She could make 2 months worth of payments, but she's only going to get 2 months worth of COBRA coverage. If she wants to continue her COBRA coverage all the way through to the end of July or August, she's got to make that full payment. And so then the question for the employer will be, how are you going to handle those retroactive premiums? Are you going to require them all to be paid by a certain date? Do you do a payment plan? You know, something to think about with retroactive premiums. Now, let's say Amy takes advantage of the outbreak period deadline extensions, and she actually elects COBRA, so her election clock starts running on July 11th, she makes her election after the end of the outbreak period, well, then the normal rules for payment are going to apply, which means she has 45 days after she makes her election to make her first payment. So if she makes her initial payment on October 23rd of 2023, that payment generally must include premiums for all the coverage periods that have come before, which go through the end of September. Because she has that 30-day grace period, she doesn't actually have to make the October premium payment at that time. She would have until the end of October to make the October payment. Next slide. Now, I mentioned retroactive premiums. That's not the only retroactive potential issue that employers were facing in the face of this outbreak period deadline extension guidance. Because during the period between the payment due date and the end of the payment grace period, a plan has a choice. And this is a rule that has been in place, for as long as I can remember. It's not impacted by COVID. The choice is, let's use our June example, right? For June coverage, payment was due June 1, but we have a grace period to make that payment. If the payment was not made by June 1, the plan can choose either to go ahead and continue coverage, assuming that the person is going to take their grace period and make the payment. If they make the payment by the end of the grace period, great. Coverage is continued uninterrupted. They are entitled to that coverage, no problem. But if they don't make the payment by the end of the grace period, then the plan can retroactively terminate the coverage back to the last date for which coverage was paid. So as employers looked at this potential for a whole year of election and an additional 45 days for payment, they started looking at, well, does it make sense for us to continue COBRA coverage during the grace period? Because what if they don't actually make their premium payments by the end of this 1 year and 45-day period? Then we're going to have to retroactively terminate coverage and request, reimbursement for all claims that were incurred during that 1 year plus retroactive period. So in the face of COVID, some employers switched to the other option, which was to terminate coverage as of the first day of the month, but retroactively reinstate it if the premiums were actually made by the last day of the grace period. So as we return back to pre-COVID days and pre-COVID deadlines, where that payment grace period is only going to be 30 days, an employer might want to think about, well, should I be terminating coverage on the first day of the period and trying to retroactively reinstate it, or continuing coverage and trying to retroactively terminate it if necessary? Now, for employers that have a COBRA administrator who takes care of all this for them, maybe it doesn't make a difference, especially if there's only 30 days worth of coverage that you have to retroactively terminate. But it's something to be thinking about as we approach the end of the outbreak period. Now, I do want to make one last note here on this slide, which is something that I don't think gets a lot of attention. It's a requirement under the COBRA regs that if a provider asks about whether somebody is enrolled in coverage, the plan is required to make a complete and accurate response. And so if a provider makes this type of inquiry while somebody is in their grace period, the plan needs to be able to say either, well, yes, they are covered, but we might retroactively terminate the coverage if they don't make payment by the end of the grace period. Or, well, no, they're not covered, but we might retroactively reinstate their coverage if they do make payment by the end of the grace period. Typically, the provider is going to direct this inquiry to the medical plan TPA. The medical plan TPA probably isn't going to know that somebody's in their payment grace period. They're only going to know whether the person's enrolled in coverage or not enrolled in coverage. And so there's a difficulty in trying to coordinate a response to this type of inquiry. If that's not something that you've addressed with your medical TPA and your COBRA administrator, it's something that you might want to take the opportunity to do now as we are approaching the end of the outbreak period. All right. One last example, healthcare FSA claims extensions. So I mentioned that the outbreak period deadline extensions apply to deadlines for filing claims under ERISA plans. Well, healthcare FSAs are ERISA plans. And so the claim filing deadline has to have been extended for the outbreak period, but no more than a year. And the claim filing deadline for a healthcare FSA normally is the date to request reimbursement for expenses incurred during the year, which normally is something like 90 days after the end of the plan year. This has created a lot of administrative difficulty, especially for FSA plans that have carryover. So let's look at an example here. Let's say normally the plan requires claims to be submitted within 90 days following the end of the plan year. And we're back to our assumption that the outbreak period is going to end July 10th of 2023. So let's say we're looking at 2021 expenses and we've got a calendar year plan. Those 2021 expenses normally have to be requested by March 31 of 2022. Well, we know that the period of January 1 through 2022 through the end of the outbreak period is generally disregarded. That's more than a year, so we're only disregarding a year, which means that the claim filing deadline is 90 days after the end of 2022 or March 31 of 2023. So the FSA plan really should have been holding on to those 2021 funds until March 31 of 2023. That's a long time for dealing with FSA claims. Chances are you're not going to have somebody in March of 2023 that suddenly finds and submits a receipt from 2021, but it's possible. Now let's look at an example of where the outbreak period deadline extension, cuts that short. For the 2022 reimbursement requests, they normally would have been due March 31 of 2023. We have to disregard the outbreak period, so we start our 90-day clock on July 11th, 2023, which means our claim filing deadline is October 8th, 2023. And with that, I'm going to turn it back to Mark to talk a little bit about plan documentation and communication.
Thanks, Kim. So, what we've discussed so far and the complexity involved, I think plan sponsors sort of want to know what communications do they have to make to their participants, what communications can they make, are there any that are absolutely required, and what's the best practices going forward. So there's a rule that says if you're making changes to the information that is in your summary of benefits and coverage, you need to provide a 60-day advance notice of the change. And whether something that we've discussed today is going to impact your SBC, you're going to want to confirm that by looking at the individual summary of benefits and coverage. However, with that said, there is guidance from the agencies that said, even though you're making these changes that typically would require a 60-day advance notice, if back when the public health emergency started, if you communicated to your employees that once the pandemic ends and this relief ends related to the public health emergency and the national emergency, once that all comes to an end, that you're going to automatically be reverting back to pre-pandemic rules, then you don't need to provide that advance notice. However, you still may need to provide some notice, because under ERISA, if you make a material reduction in benefits, you have to provide notice within 60 days following the effective date of the change that you made that change, and you need to communicate that to your plan participants. And so I think one last caveat here is regarding your fiduciary duties. You may want to make a communication as a fiduciary of the plan if it would be in your best interest, or really specifically in the best interest of your plan participants, that they be notified of these changes related to their benefits. These are important benefits that people rely on, and they've come to rely on these extended deadlines, and you want to make sure that you're acting in your best interest of your plan participants with regard to communicating these changes that are going to be being made in the upcoming months. So now I'm going to turn it back over to Kim to discuss some deadline extensions and COBRA election notices.
So to emphasize the point that Mark just made about maybe you've got a fiduciary obligation to communicate when you don't have a other legal obligation to do so. When we got that guidance, sort of the follow-up guidance on the outbreak period deadline extensions, and the agencies came out and said, oops, we don't have authority to require you to extend your deadline for more than a year. They provided some thoughts in that guidance that essentially said, look, we know that people are encountering problems with COVID, with deadline extensions, And we want to just highlight the guiding principle for administering employee benefit plans is to act reasonably, prudently, and in the interest of workers and their families. So that means that plan fiduciaries should make reasonable accommodations to prevent the loss of or undue delay in payment of benefits in such cases. Next slide. And the plan may consider affirmatively sending a notice regarding the end of the relief period. Plan disclosures that have already been issued may need to be reissued or amended if the disclosures fail to provide accurate information regarding the time in which participants and beneficiaries were required to take action. Now, we do anticipate that we'll get some guidance from the agencies before the end of the national and public health emergency. It is entirely possible that they'll echo this type of guidance that they provided back in 2021 and encourage you to provide notices or take specific actions to help participants as you're approaching the end of the outbreak period. And I want to make one note with regard to COBRA election notices. So as we're thinking about disclosures and approaching the end of the outbreak period, the COBRA election notices, according to the regulations, need to include a number of things, including but not limited to an explanation of the time period during which the election must be made, a date by which the election must be made, and theoretically those two should coincide with one another. The times within which notices of disability or second qualifying events must be provided, a description of the due dates for payment, the grace period for payment. So all of these things were impacted by the outbreak period. So we saw generally a response from COBRA administrators who updated their COBRA notices to reflect the outbreak period deadline extensions by slapping an insert in the COBRA packet that says, okay, despite what's in the COBRA notice, really you have this extra time to take these actions. Now, there's a series of COBRA cases out there right now which are challenging the sufficiency of the COBRA election notices. And as part of that, some of the more recent cases challenged the use of this, insert approach. And so you may have worked with your COBRA administrator to sort of sprinkle those deadlines throughout the COBRA notice. If that's the case, you're going to want to make sure you go back to your pre-COVID notices. We want to make sure you're taking those deadline extensions out, because when it comes to July 11th of this year, that won't be accurate anymore. And you don't want to leave yourself open for, number one, a participant to make a claim that they've got more time to take COBRA actions than what was provided in the notice, or number two, that the COBRA notice is deficient under the COBRA regs because it included the incorrect information. So Mark, do you want to take us through some next steps for employers to consider?
Absolutely. So I think, the first thing to do is to determine the extent to which the plan design will revert to the pre-COVID terms at the end of these national emergencies and the outbreak periods. And, think about those changes that can still apply following the end of the public health emergency. Do you want to continue covering COVID diagnostic tests and related visits at 100%? What do you want to do with that population of people who are, enrolled in a high deductible health plan? Think about the things that you're still going to be required to do. While you may begin to impose cost sharing for COVID-19 vaccines from out-of-network providers, remember that, as long as those vaccines remain, on the preventive services list under the Affordable Care Act, you're still going to have to provide them at 100% in network without any cost sharing. Second, review prior communications and amendments to confirm the need to adopt amendments to implement post-pandemic plan design. So, for example, maybe you did a summary of material modification at the beginning of the public health emergency that said, we're making X changes. These changes will be in effect until the announced end of the public health emergency or the national emergency. Now, let's say maybe, you're thinking about extending relief that maybe at the beginning of the pandemic you think you wanted to do. You're going to need to go back and amend your plan again if this is something that you want to keep going afterwards, and reissue a new summary of material modification to include those provisions that would have automatically sort of sunsetted after you issued that initial SMM that said once the public health emergency is over, you're not going to have any additional relief. So third, you should consider the extent to which communications about post-pandemic plan design must or should be provided and the timing of those communications. So I think the big takeaway here is to, recognize the importance of your fiduciary duties that, Kim talked about, and, you want to provide sufficient communication to the participants and the beneficiaries in your plan so that they can make the best decisions that are, most appropriate for them. Fourth, determine whether and how to make additional communications about the outbreak period, deadline extensions, and the end of the outbreak period. So, this is pretty important because there was individuals who may have believed that they have a full year to make an election or, to make payments for COBRA continuation coverage. So I guess take an example where somebody gets married or has a child last November. He or she may think that they have a full year to make a decision, and at the end of the outbreak period, the end of the outbreak period may be coming sooner than they initially think. If they think, oh, I have until November to elect my coverage or to make payments, they're not necessarily keeping up with the end of the public health emergency, and they don't follow President Biden on Twitter, and they think they have this year, and now they don't, and these coverages are important to them, and now they haven't been advised of election periods that are coming to an end. So the fifth box is consider how to address premiums for retroactive coverage period. And I think, here most plan sponsors and plan administrators don't want participants to be unaware of deadlines related to their benefits. So, think about whether you're going to institute payment plans and allow payments to be, made over time. Are you going to require all the money to be paid up front? And I think the last thing is, maybe not necessarily a legal implication, but it's still very crucial to coordinate with your vendors. For a couple of reasons. I think the first thing is you want to make sure that everything that you want to implement or remove is actually implemented. And, you're going to have to communicate with your vendors, to make sure those things happen. And secondly, I think you want to make sure that whatever you decide that you want to implement, that your vendors can actually implement. I've dealt with, employers who, we advise them on what they can do, and then they go back to their vendors, and their vendor says, "Oh, we have system constraints, we can't possibly implement that," and then you have to sort of start from scratch again. So think about your COBRA administrator. Do they have the ability to institute a payment plan if that's something you want to do, or are they only going to be able to make sure that payments are made in full after the end of the public health or at the end of the outbreak period? So, proactive communications with your vendors are always best to, alleviate any possible issues. So I think that concludes the prepared portion of today's webinar. In our remaining time, I'll address some questions that have come in, and we do have a question. Are we required to notify those eligible for COBRA of their new deadlines to enroll or pay, even if they received a packet in the past with the original outbreak extension language? So, Kim, do you want to take that?
Sure. I don't know that there's a legal obligation to do that, because they were informed that that this is their payment deadline. Theoretically, they were informed that their payment deadline was extended during the outbreak period. If you feel like that communication was clear and understandable, and the person would know when the outbreak period was going to end and when their deadline, was going to be, then there's probably not an obligation to notify them again. If you have any question about how clear that was or how understandable it was, and you want to try to avoid a situation where somebody comes back to you 3 months down the road and says, "I didn't know that the outbreak period was over. I didn't realize," or "I just missed it, and please help me out." That's where the proactive communication can avoid some of those types of employee relations issues.
Thanks. I've got another one. If we as a plan sponsor want to continue to waive cost sharing for COVID tests, how do we determine whether we're violating the mental health parity rules?
So this, Mark talked about this a little bit at the beginning of the webinar. The mental health parity rules have a quantitative treatment limitation test, which is a numerical test, which is different from the non-quantitative treatment analyses that you may be dealing with right now with your vendors. The quantitative treatment limitations rules say that you can impose cost sharing on mental health services only if you're imposing cost sharing on substantially all of the medical surgical services in that same classification. Substantially all is essentially 2/3. So you would need to take a look at, and let's say it's outpatient service, in-network outpatient services. You would need to take a look at all of the medical surgical services that are inpatient out-network, and do we apply cost sharing to 2/3 of those? And we count 2/3 by reference to the dollar amount that the plan is expected to pay for those services during the year. If we start waiving cost sharing for medical services, then the amount of medical services that we're applying cost sharing to obviously is reducing. So it's possible that we get below that 2/3 threshold. If we get below the 2/3 threshold, then we can't impose that type of cost sharing on mental health services in that same classification. So that's really the rub, is if we are waiving cost sharing for a medical service, does that impact our ability to imply cost sharing to the mental health services? Have we reduced below that 2/3 threshold? And I will say that the agencies expect you to use your own plan data to make this determination, whereas many administrators want to use their book of business data to make that determination. So if you haven't revisited these rules in a while and you plan to waive cost sharing after the outbreak period, it's something worth investigating a little more closely. Now, Mark, I've got a question for you. If an individual has timely elected COBRA after relying on deadline extensions, but has yet to make any payment, is there a requirement to permit payment plans, or can the plan require a immediate payment of all back payments and then terminate COBRA coverage if the payments are not made?
Yeah, there's really no requirement to offer any payment plan, but I think it's important to keep in mind that they will still have that default 30-day grace period for payment of future COBRA payments. Obviously, depending on when they were eligible and when they elected, there could be a large amount of premium payments that are due. I think another thing that you want to make sure you think of is that you're administering these decisions consistently among all qualified beneficiaries. It's important to make these decisions now and so that you can administer them consistently going forward across anyone who would be implicated by these COBRA payments. And I think it's also important to communicate with your COBRA administrator. So like I said on this last slide, it's important to coordinate with your vendor to make sure that they can implement the changes that you want implemented. If that includes allowing a payment plan, make sure that they can accommodate. And also, lastly, I think it's important to think about what you told individuals when they first elected COBRA or when they first became eligible for COBRA. If you didn't make any promises that you would offer a payment plan, if you told them that their premiums would all become due within 1 year or at the end of the public health emergency, then, or at the end of the outbreak period, I guess, then I think you're going to feel better about not offering a payment plan to those individuals. So we're
all right. Well, I think that brings us to the end of the hour. I want to thank Mark for his assistance today and to all of you for attending our webinar. If you have questions that we weren't able to cover, go ahead and reach out to your Thompson Hine attorney. And if you don't have a Thompson Hine attorney, you can reach out to me or Mark directly. Thanks so much and enjoy the rest of your day.